Premier, thanks for inviting us to this roundtable. And my question, Premier, is we know this is a hard time, and businesses are closing, and they're concerned about the restrictions as well. And even people are concerned. But I mean, based on what you do, Premier, I'm assuming the Albertans are not doing a good job to keep safe or to stop the spread of COVID. My question is, do you have any plan to contain somehow this pandemic? So don't go, I mean, at this point, we won't go back to the restrictions?
Yes. Thank you, Hector. Great questions. So most of the pain felt by businesses, I think, was the result of the global economic collapse, the largest global depression or recession since the 1930s. Plus, in Alberta, we were hit doubly hard by the biggest collapse ever in energy prices. And those two things on top of 5 pretty tough years in Alberta. Then, of course, some businesses, particularly in the service industry, like restaurants and the entertainment sector, have been hit with restrictions throughout the pandemic. I am optimistic that if we can just get through the next month, basically, we can start relaxing restrictions and then go into the summer with a totally different situation. And the game-changing difference, well, first of all, weather and climate help. As we saw last year in the summer, the numbers went way down. And so apparently, respiratory viruses like this transmit less easily in warm weather. And so the weather is on our side, but the biggest thing on our side is the vaccines. So we're now at 50% of eligible population vaccinated. And I believe by July, we could be well over 70%. On top of that, 10 to 15% of Albertans have been infected and are carrying antibodies, which give them a level of immunity or protection. So if you take the naturally immune population, add on to it the population that has protection from vaccines, you get to a point where the virus starts running into a wall. Right now, every other person that the virus meets is protected. The elderly and the people with chronic health conditions are protected. Increasingly, middle-aged and younger people are protected. That's what gives me confidence to say that when we lift public health restrictions over the next few weeks, it will be for the last time, and we'll be able to move on with our lives this summer. There will still need to be some care and caution taken, I think, in the future. And we're going to have to monitor closely the variants to make sure that we don't end up with variants that breach the protective effect of the vaccines. But I'm optimistic that this summer we can get largely back to normal. Cut social interactions so we can get the COVID spread down, so we can stop the spike, the third wave, or this spike that we've experienced that hit Alberta pretty hard. The bad news is that we expect to see growing hospitalization numbers for the next week or two. But the good news is that the new case numbers and total active case numbers are coming down pretty quickly. We've gone from 26,000 active cases a little over a week ago to about 18,000 now. So things are going very much in the right direction. I also want to thank Albertans for their tremendous response to the vaccination program. We've been hitting record high numbers for vaccinating Albertans. The other day, we vaccinated 60,000 people on one day, and we have the capacity to vaccinate up to 80,000 a day if we get enough supply. And that supply is finally starting to come in large numbers. In fact, we we are promised 1.2, 1.3 million doses of COVID vaccines from Pfizer and Moderna over the next 4 weeks. And we have nearly 800,000 appointments booked. Yesterday, we passed 50% of the eligible population who have received at least one dose. That's all Albertans age 12 and older. And that represents 42% of the total population if you include younger children. So I believe that if Albertans continue to respond positively to the vaccine program, that we'll achieve 70% of the eligible population vaccinated by, I hope, mid-June. That gives us a lot of potential, a lot of promise to lift the public health restrictions that are in place. Today, Education Minister LaGrange announced that K-12 schools will resume in-class instruction next Tuesday, May 25th, following the long weekend, with the exception of Fort McMurray Wood Buffalo, which unfortunately is dealing with the hottest COVID outbreak in Canada right now. But we hope that they'll be able to come back to school a week later. We know that kids have suffered through COVID, their learning has been diminished, and we will be announcing additional resources to help kids catch up on their learning, especially younger children, on key things like reading and math. But right now, I want to turn it over to your questions. As I say, I believe things are going in the right direction, and I hope to make an announcement about a week from now about Alberta's path forward out of COVID and beyond the pandemic to, I hope, a great Alberta summer where we'll be able to lift, I hope, the vast majority of public health restrictions in July and enjoy a wonderful, bright, and optimistic Alberta summer, and then get refocused on economic recovery and building a strong province. So with that, I'm looking forward to your questions.
Thank you, Premier Kenney. We're going to begin this evening with our question and answer period. I'll be calling your name and outlet one by one. We just ask that you stick with one question to start, and if we get through everyone, we'll come around for another opportunity for questions. So let's begin. And I'd like to ask Hector from Canada Latin Channel to ask his question. Welcome, Hector.
Thanks, Danielle.
The United States, they're letting Canadians visit. So really the question goes to them. Are you allowed to cross the border? Yes. As far as I know, they are welcoming Canadians. And if they're going to offer Canadians a dose, then I don't see any barrier to that. We're not going to stop people from doing that. I would just want to counsel people to be very sure that if they do that, they're doing it within the recommended interval between the first and second dose, and that they're getting the second dose from the same vaccine. So if their first dose in Alberta was a Moderna, and they happen to be outside the country 2 to 4 weeks later in the interval period, and they want to get a second dose, then they should make sure that dose is the Moderna. Pfizer and Pfizer, AstraZeneca and AstraZeneca. So that would be my advice, but there's nothing blocking people from doing that. And I will tell you, I spoke to the governor of Montana a couple of times in the last month. They've opened up a very helpful program for us to inoculate Alberta truck drivers who are coming home. When they're passing through Montana, they can stop and get their vaccines there because they have surplus vaccines. And secondly, the Blackfeet First Nation south of the Alberta-Montana border has had a large surplus of vaccine doses, and they've welcomed Canadians to come down and receive those. Alberta Health has been working closely with major summer event organizers and with all of the different professional and amateur sports leagues and organizations to develop protocols for safe operation this summer. But obviously, that will be much easier with outdoor events. Now, you're going to have to stay tuned. I'll have a major event about a week from now on the path forward for reopening. We hope for the last time. And we do hope that we can facilitate large summer outdoor events this summer within certain parameters, and that would include sporting events. So just stay tuned for the results, but that's one of the reasons why the Calgary Stampede felt comfortable to move forward with announcing their intention to hold a scaled back Stampede. It's been announced that we gave an exemption to rodeo in rural Alberta to have crowds of a certain size. Again, exactly how many people will be able to attend those events and starting when, we'll clarify beginning about a week from now. But I do believe that we'll be able to get people together for CFL games, for soccer games, et cetera, in the latter part of this summer, not right away. In terms of the big crowds that are happening in the States, look, the United States was months ahead of us on their vaccination program because we weren't getting the supply in Canada. But they were also much further ahead of us when it comes to natural immunity from prior infection. But they paid a steep price for that. The death rate per capita in the United States from COVID has been 4 to 5 times higher than in Canada. So I'm glad that we didn't experience that kind of death rate, but as a result, we have fewer people with natural immunity. Long story short is we are catching up to the Americans with our vaccine program now. And that's what gives me confidence we'll be able to move forward and have events like they are, but just a little bit later. We basically lost 2 to 3 months versus the Americans when it comes to opening up like that. And in terms of Quebec, I envy the Canadians that they can open up for limited in fans in the arena, but the Quebec COVID numbers are much lower than here. Their hospitalization numbers are about 25% of ours on a per capita basis, and their new cases over the past week are again about 25% of Alberta's. Ours are 4 times higher per capita. And that's because Quebec has had a brutal, tough lockdown now for months. Stay-at-home orders, curfews. You can't leave your home in Montreal after 8 p.m. So I guess the benefit of that brutal lockdown is they're now able to open up a little bit more quickly than us, but that's been a tough price to pay as well. And it's true that women have been hit harder in this COVID recession. For a number of reasons. One is sometimes schools being closed and interrupting childcare at home. Also, many women work in the service industry that has been most heavily hit by restrictions. And so I think the most important thing we can do, get as many people as possible vaccinated so we can open up, lift the restrictions, ensure that schools are going to operate in classroom instruction next year, stabilize the childcare situation, and get the service industry back to work. But there are many women as well who would like to pursue new careers in new emerging industries that we have in Alberta, like the digital industry, and they're facing a labor shortage. So the Jobs Now program is designed to help those employers train people so they can get those new jobs. And of course, as Minister Sawhney said, we want to make sure that we address the groups that are underrepresented in the workforce, that are below average levels of employment, like women, immigrants, and youth. So there will be a particular focus on those people in the Jobs Now program. There are a couple of programs that are still in preliminary trials, one out of Calgary, one in Edmonton, and they're at phase 1 of their trials. The unfortunate thing is that by the time they get to phase 3, we'll largely be vaccinated around the world. However, we'll certainly be vaccinated in Canada. Now, however, I think it's still worth them doing these projects because we need our own domestic vaccine development and production industry here. We fell behind the United States, UK, and other countries with the vaccine rollout by several months because they have their own domestic production and development. And we became victims of what is called vaccine nationalism, where, for example, the United States, the European Union, and now India had restricted exports of vaccine supplies so they could focus on their own populations. We must never allow ourselves to be put in that situation before. Again, pardon me. So I have co-chaired a group of a discussion amongst all the 10 provinces on how we can support domestic vaccine production and product development. Here in Alberta, we did a request for proposals for vaccine programs that we are considering funding or supporting in some way. So long story short is, yes, there are some early stage COVID-19 vaccine programs here. We have a brilliant center of excellence at the University of Alberta. It's the Li Kai-shing Institute for Applied Virology, and it's headed by Dr. John Houghton, who won the Nobel Prize for Medicine last year for his discovery of hepatitis C. And they are quite, like, they are world experts. So I announced a $20 million grant to them, and we may be providing other support to some of these nascent vaccine programs in Alberta. And they continue in place, and I expect that they will for some time to come. I hope that once we see higher levels of vaccinations, the federal government will begin to relax the quarantine requirements. We will have to maintain some real vigilance for international travel because of the variants. Right now, we have a particular concern about the so-called Indian variant because there is some evidence that vaccines may be less effective against the Indian variant and the Brazilian variant. So there has to be continued good scrutiny for international travel, but I will certainly be advocating a relaxation of some of those quarantine requirements, because we need to get our economy back fully, especially our tourism industry, which is so important to Alberta. We need to have much more reasonable quarantine requirements. So I think we can do the same. I think we can properly screen with testing for the variants, testing before people leave, testing when they arrive, but then we without a 2-week quarantine. So that's what I will be advocating for a little bit later this summer. So thank you again. I really hope that the next time we do one of these, we'll be celebrating Open Alberta. We'll be celebrating an Alberta Renaissance. We'll be celebrating a stampede. We'll be celebrating a great Alberta summer. Let's give people that sense of hope and optimism, because it really is on very close. We get closer every day as tens of thousands more people get vaccinated. So good news is coming. And thank you once again for your interest and your public service that you provide through your media outlets. God bless you all. Thank you.